Next group of manual muscle testing is going to be for the elbow and the forearm. The first ones are going to be for our elbow flexors. The first one is going to be our biceps brachii. Our biceps brachii. For this one, what we're going to have her do either in a standing or a sitting position. And what we're going to do is we're going to have her her arm in neutral with 90 degrees flexion at the elbow. And also we want to make sure that her palm is up. We're going to kind of stabilize her elbow into the side of her body, and we're going to apply our resistance on the distal forearm while she comes up into flexion. Okay, go ahead. And that's for biceps brachii. If we do the brachioradialis muscle, that's also an elbow flexor, she's going to have the thumb up, still the same position, the elbow's bent at 90 degrees, and she's going to raise her arm up against resistance. Go ahead all the way. And then the last one that we're going to do is going to be with the palm down. This is the brachialis, again at 90 degrees elbow flexion. And she's going to be flexing her elbow again with the palm down for the brachialis. The next one that we're going to do, we can also do the triceps. For this one, I'm going to go ahead and have you stand. And go ahead and face that way. And what she's going to do for this one is she's going to, let me turn you just, she's going to slightly hyperextend the humerus, the shoulder, and while she's in that position, basically I just want you to kind of relax your elbow there a second there, so it just kind of drops. So in this position, what she's going to be doing is she's going to be extending her forearm into elbow extension. Okay, and that's for the triceps brachii. And then the next one that we're going to do is go ahead and turn towards the camera. We're going to do our pronators, our pronator teres, and our pronators quadratus muscles, which are, if we put her up here into 90 degrees elbow flexion, and again kind of stabilizing her. Probably the simplest way to do this, if we're testing our pronators, you want to put her into extreme supination, and then you're going to do it, grab her like as if you were doing a handshake, and then you're going to have her do pronation against your resistance. Again, this is against gravity. And that's assessing your pronator teres and your pronator quadratus. If you want to assess your supinator muscle, you put her in extreme pronation, same position, 90 degrees elbow flexion, and she's going to come up. Go ahead. Against your resistance. Again, that's against gravity and supinators. Next manual muscle test that we're going to do is going to be the Extensor Carpi Radialis. This is a wrist extensor and also a radial deviation. So what you want to have them do, you want to have her elbow flexed, and you can either do the standing or on the edge of a table sitting. And you want to try to put them in the extreme opposite. So I'm going to have her in wrist flexion, and I'm also going to have her in ulnar deviation. Okay? And then what I'm going to have her do is I'm going to have her come up into wrist extension and radial deviate. And your resistance is going to be kind of on the inside. So again, she's going to come up in this, up and back in this direction. Okay, go ahead. Okay, go again, one more. Okay, and that's the Extensor Carpi Radialis. The next one that we're going to do is the Extensor Carpi Ulnaris. And for this one, she's going to be doing wrist extension and ulnar deviation. So we want to put her in the extreme opposite. So we're going to put her in wrist flexion and radial deviation. And she's going to, again, come up and out towards me. And my resistance is going to be on the 5th metacarpal. Okay? That's your Extensor Carpi Ulnaris. Next, we're going to reverse, going palm up. And then we're going to assess our flexor muscles. Our Flexor Carpi Ulnaris is going to be a wrist flexor and a ulnar deviator. And for this one, I'll put her in extreme opposite, so I'll put her into hyperextension or extension of the wrist, and radial deviation, and I'm going to have her come up and with that muscle. That's Flexor, Carpi, Ulnaris. And the last one that we're going to do is going to be Flexor, Carpi, Radialis. Again, keeping her at 90 degrees flexion, palm up. This is going to be a wrist flexor and a radial deviation. So I'd put her in the extreme opposite, and she's going to come up and out towards me against my resistance on the thumb side. That's it.